How's it going? Hope everyone's staying safe during these crazy times. I'm Dr. Eric Sonati. I'm a physical therapist at Catamount Physical Therapy in South Burlington. And I'm here to talk to you guys today about two things: falls and balance and vertigo. So I'm sure you guys know someone or have had someone in your family that has dealt with falls or have had falls in the past, or maybe you yourself have had some issues with falls and balance. And it's very common in our country, especially in individuals over the age of 65. So I'm going to give you guys some stats that kind of put that in perspective, and then we'll talk about how physical therapy helps with these issues and makes everybody a little bit safer and decreases their fall risk at home. So about 23% of Americans over the age of 65 have reported a fall in the last year. 30 to 40% of people over the age of 65 will have at least one fall in general. And each year, there are 3 million emergency department visits from people that have either had falls or have injured themselves from falling. So again, very, very common issue that most people have to deal with at some point in time. So physical therapy is a great way to address some of these issues. And what we would have you do is come into Catamount Physical Therapy. We'll get you an evaluation one-on-one with a physical therapist, and we'll assess your balance. We'll assess your risk for falls. We'll take a look at how you're walking. We'll talk about some education pieces to make you safer at home. Then we'll also look at your lower body and leg strength to see how stable you are to keep yourself on your feet. What that will do is that will bring us to our treatment and our treatment approach that will work on together to get the best result possible and make everybody a little bit safer at home. So what we'll work on is dynamic and functional balance activities that will relate to what you do in your day. We'll work on your walking to make sure that you're not catching your toes or increasing your trip or fall risk. And then we'll also work on that lower extremity strength, that leg strength, to make sure that you're as strong as possible, because the stronger you are, the more stable you are. And in general, that will decrease your fall risk and make you a little bit safer. So now let's switch over to vertigo. So vertigo, again, very common issue. 40% of adults have some kind of dizziness or vertigo symptoms in our country. And what vertigo actually is an inner ear issue where some crystals in our inner ear get loose and get caught in our inner ear canals. And what that causes is it causes some dizziness, some sensation of the room spinning or like you're spinning in circles. And it can be brought on by things simply as going from sitting to lying down, lying to sitting up, sitting to standing, rolling in bed, or even a quick head turn can bring on some of these symptoms. So for us as physical therapists, again, we have you come into Catamount to get initial evaluation. And what that incorporates is some movements to find the root cause of your dizziness and vertigo and what ear is being affected. And then we'll also, again, assess your balance to make sure that you're stable and assess your fall risk for when this dizziness is kicked up. And that, again, will lead us into our treatment approach. And our treatment approach will include some movements specific to get those crystals back into the inner ear where they should be and out of those canals so that your dizziness and spinning symptoms go away. Once that's taken care of, we'll start to address your balance, make sure that you're stable, so that when you do have these symptoms, your body has some ability to keep you upright and safe for when you're spinning or when your dizziness is really high. So if any of you guys listening to this have had falls in the past or have some vertigo symptoms, or if you know anyone that has had some vertigo symptoms or falls, give us a call at 802-864-0015 or visit our website, catamountpt.com. and schedule an appointment, and we'll get you in to see one of our physical therapists and start addressing some of these issues and moving forward, and hopefully get you feeling better and keep you safe at home. So thank you for your time. Again, stay safe, stay healthy, and we'll see you soon.